Researchers here have found that 1 in 3 adults are anxious and depressed due to the COVID-19 pandemic. Those more prone to psychological distress include women, younger adults, individuals of lower socio-economic status, and those living in rural areas, as well as people at high risk of COVID-19 infection. These findings come about after a Duke-NUS Medical School team performed a meta-analysis of 68 studies conducted during the pandemic. It covers nearly 300,000 participants from 19 countries. And for more, we have with us Professor Tazeen Jafar from the Health Services and Systems Research Program at Duke-NUS. Thank you, Professor, for joining us this evening. Firstly, your team analysed over 60 studies from 19 countries. What are some of the similarities and differences that you found?
Yes, well, thank you, first of all. I'm delighted to be here. So I think, we analyzed data on 68 studies from 19 countries. The key thing that we found was, like you said, 1 in 3 adults had anxiety or depression. And the key factors associated were women, younger compared to older adults, those living in rural areas, those of lower socioeconomic strata, meaning those who had lower income, lower education, or were unemployed, and those who are at higher risk of COVID-19, means those with comorbid conditions or those who were exposed to COVID-19. And so these findings were actually pretty uniform across all the studies from the different, and we had all the 6 WHO regions represented in these 19 countries. So these are pretty uniform across. The differences were primarily in the strengths of the associations. And so women somehow were more strongly associated, the association was more stronger with anxiety in the Asian countries compared to European countries. So somehow, but other than that, they were pretty uniform. And so it's very, very high risk, again, of psychological disorders during the pandemic. And that's in pretty much all the regions, and pretty uniform in terms of the risk factors.
Professor, it seems that those under the age of 35 years are more vulnerable to psychological distress. Why is that so?
That's a great question. And that's quite contrary to what we see otherwise in anxiety and depression, because generally it's the older folks. So in the pandemic, I think there are several reasons that could potentially explain the younger individuals being more predisposed to these disorders during the pandemic. First of all, the way these lockdowns happened and the abrupt nature of the closure of the educational institutions and the workplaces, and the way the younger folks look at the future prospects. So that's one. The second is how their social networks and the social interaction, and they play a huge role in the mental well-being of the younger individuals. So so I think they've been disrupted a lot. Then another big factor is somehow, these younger folks don't have any past experience. The older folks have had, especially in the Asian region, a lot of, there's past exposure experience with the SARS epidemic and with other epidemics. Example, in Africa, they've had Ebola. The younger generation doesn't have that historical experience. So this is their first exposure to an epidemic of this nature. So that's pretty unfortunate. And then the children and the teenagers, they don't have coping mechanism, emotional responses that have been well developed. And they experience very high stress under challenging situations. So I think it's just a number of these factors cumulatively together under these very, very unusual and challenging circumstances of the COVID-19 that the younger folks are experiencing a very, very high level of a lot of stress. And they cannot just have these avenues that they had, going to school, going out and partying with friends or meeting with them to relieve the stress. That's just taken away. So that's why I think we're seeing these impacts.
Oh, thank you very much for helping us understand them as well. Thank you, Professor Tazeen Jafar from Duke-NUS.